taking opioids for Crohn's pain and your gut symptoms are getting worse instead of better, this isn't just bad luck. There's a clinical syndrome for exactly this, and your doctor needs to know about it. Hi, I'm Kate, and today we're talking about narcotic bowel syndrome and why the pain medication that's supposed to help your Crohn's might actually be making your gut worse. Now, this matters right now because I'm seeing more and more people caught in a cycle where they're taking stronger and stronger pain meds but feeling worse and worse, and nobody's connected the dots. Here's what I see. Someone comes to me who's been on opioids for months, sometimes years. They started with something mild after a flare or surgery. It helped at first, but now they're taking more and their pain is actually worse than when they started. They've got more cramping, more nausea, more constipation. They feel like they're failing at managing their disease. And here's the heartbreaking part. They think it's their Crohn's getting worse. They think they need even more pain relief. But when we look at their recent scopes or imaging, their inflammation markers are actually stable or even better. What's happening isn't Crohn's progression, it's something called narcotic bowel syndrome, and it's a recognized clinical condition that gastroenterologists see regularly. But patients often don't know about it until they're deep in the cycle. So let's get clear on what this actually is. Narcotic bowel syndrome happens when chronic opioid use changes how your gut and brain process pain signals. Instead of blocking pain, the opioids start increasing your sensitivity to pain. Your nervous system gets more reactive, not less. It's not about being weak or addicted in the way most people think about addiction. This is your nervous system adapting to the medication in a way that backfires. Your pain threshold drops, your gut motility slows down, and you end up with more pain, more bloating, more nausea. Symptoms that look exactly like a Crohn's flare, but aren't inflammation driven. Here's what most people get wrong. They think the choice is between suffering in pain or staying on opioids forever. But there's a sane middle path. There are evidence-based approaches that address gut pain without opioids, approaches that gastroenterologists and pain specialists actually recommend, but that most Crohn's patients have never heard of. This isn't about toughing it out, it's about understanding that gut pain needs gut-specific pain management, not just general pain relief. All right, here's what you need to know and what you can actually do about this. First of all, you need to recognize the pattern. Narcotic bowel syndrome typically shows up when someone's been on opioids for more than 3 months. The hallmark is that your pain gets worse when the medication wears off. You need increasing doses to get the same relief, and your gut symptoms, cramping, bloating, nausea, constipation, are getting worse, even though your inflammatory markers are stable. If that sounds like you, write down your pattern. When does the pain spike? How much medication are you taking compared to 3 months ago? What do your recent test results actually show about inflammation? Bring this information to your doctor. Say the words, narcotic bowel syndrome, and ask if this could be what's happening. This isn't about blaming your doctor for prescribing opioids. Sometimes they are necessary short term, after surgery, or during a severe flare. But chronic opioid use for chronic gut pain is where the risk lives, and it's important to name it. Understand the weaning process. If you and your doctor determine that narcotic bowel syndrome is happening, the treatment is gradual opioid reduction, not cold turkey. That's dangerous and totally unnecessary. A slow, supported taper under medical supervision. And here's what matters. During the taper, your pain will likely get worse before it gets better. This is expected. This is your nervous system recalibrating. It usually takes 2 to 4 weeks after you're completely off opioids for your pain sensitivity to start normalizing. You need a doctor who understands this timeline and won't panic and put you back on opioids when pain spikes during the taper. You need a plan for what you will use for pain management during this transition, Which brings me to the alternatives. Gut-directed hypnotherapy. This is the most evidence-based non-drug approach for functional gut pain, and the research for IBD-related pain is growing. Gut-directed hypnotherapy isn't about being in a trance or believing really hard. It's a structured protocol that retrains how your gut and brain communicate about pain signals. There are apps now, Nerva is one, Zemedy is another, that deliver this protocol at home. The research shows that after 7 to 12 weeks of regular practice, most people see a significant reduction in gut pain, bloating, and pain-related anxiety. My son used gut-directed hypnotherapy during his Crohn's journey, and I watched it change his relationship with pain. Not because the pain disappeared, but because his nervous system stopped amplifying every sensation into a crisis. That's what we're aiming for, a recalibrated pain response. Cognitive behavior therapy for chronic pain. CBT for pain isn't about thinking positive or pretending pain isn't real. It's about changing the behavioral and thought patterns that amplify pain. Things like catastrophizing. This pain means my Crohn's is out of control, or avoidance behaviors that actually increase pain sensitivity over time. A psychologist trained in chronic pain management can teach you specific skills, pacing, attention redirection, relaxation techniques, and how to separate pain intensity from pain suffering. These are clinical tools, not just coping strategies. And here's what matters. CBT for pain works better when you're not on opioids, because opioids interfere with the nervous system retraining we're trying to do. Low-dose naltrexone. This is where it gets interesting. Naltrexone at high doses blocks opioid receptors and is used to treat opioid addiction. But at very low doses, 1.5 to 4.5 milligrams, it has a completely different effect. Low-dose naltrexone modulates the immune system and appears to reduce gut pain and inflammation in some people with Crohn's. The research is still emerging, but gastroenterologists who are familiar with it often use it as part of a pain management plan, especially when weaning off opioids. This is a prescription medication. You need to discuss it with your doctor, but it's worth knowing about because it represents a different approach, addressing pain at the immune and nervous system level rather than just blocking the pain signals. And 6, the support structure. Getting off opioids when you have chronic gut pain requires more than just willpower. You need a team. Ideally, that's a gastroenterologist who understands narcotic bowel syndrome, a pain psychologist or therapist trained in CBT for pain, and potentially a naturopath or integrative doctor who can support your nervous system regulation through nutrition, sleep, and stress management. You also need people around you who understand that this is a medical process. It's not a moral test. Pain is real. Opioid dependence is a physiological reality, not a character flaw. You're not weak for being on them, and you're not a hero for getting off them. You're just someone navigating a complex medical situation and making informed choices. So, let's come back to where we started. If you're taking opioids for Crohn's pain and your gut symptoms are getting worse instead of better, you now know there's a name for this: narcotic bowel syndrome. It's real, it's recognized, and it's treatable. The path forward isn't about suffering through pain or staying dependent on medication that's making you worse. It's about understanding that gut pain needs gut-specific approaches: hypnotherapy, CBT, low-dose naltrexone, and a medical team that gets it. You can feel better. But it starts with recognizing the pattern and having the conversation with your doctor that names what's actually happening. If this helped, share it with someone who's stuck in the pain and opioid cycle. They need to know this is a thing. If you want more support around pain management and Crohn's, I work with people one-on-one, and we have a whole community inside the Crohn's method where we talk about this stuff honestly. I'll see you in the next video, and have a beautiful day.